Hey guys, so this is part two of my presentation on testicular cancer. So when you have somebody who has a testicular neoplasm or tumor, there are a couple of things you have to do. First, you have to figure out whether it's a primary tumor or a secondary tumor. Secondary tumors of the testes would be stuff like lymphoma, leukemia, and metastasis from some other cancer. Say, for example, somebody has prostate cancer and metastasizes it extends into the testes, then that would not be a primary testicular cancer. It would be a secondary testicular cancer, and you would actually treat the primary cancer, which would be like the prostate here. So in terms of primary testicular cancer, there's two main subtypes. There is germ cell and non-germ cell. Germ cell tumors account for more than 90% of testicular cancers, and they're divided in two main types, seminomas and non-seminomas. These are pretty rare before puberty. Seminomas and non-seminomas have different types of treatments. The majority of people, like if you have something that is seminoma and non-seminoma combined, you treat it as a non-seminoma. So we can talk about like the difference between non-seminomas and seminomas really briefly. Not regular pure seminomas, they're pretty, they grow very slowly. They can generally be cured, and it's based on the histology or what they look like under the microscope that classifies them like this. And you don't really have to be familiar with that. That's usually more for the physician or the scientist involved in the case. In terms of non-seminomas, you have different subtypes, and oftentimes these are mixed and matched. You have embryonal carcinomas, and these can be pretty deadly. They grow pretty rapidly, and they spread outside the testes often. Yolk sac carcinoma is another type of non-seminoma. These are known as yolk sac tumors, or orchiodoblastomas. They're more common in children, especially infants, but they can happen in adults. They're actually very responsive to chemotherapy, which is a good thing. Choriocarcinoma, these are super rare, but they're super aggressive and can be bad news, and they often spread to the bones, the lungs, the brains, and they are often when they present as a mixed germ cell type, so they'll have a different type of non-seminoma with them, and you will have an increased beta HCG in these patients. Teratomas are a type of tumor that involve different layers of the developing embryo. So they have an endodermal, mesodermal, and ectodermal layer all involved, so you can find like teeth and weird things in them. The pure teratomas are often rare. They're also, again, generally part of mixed germ cell tumor. Those are the main types of germ cell tumors. Non-germ cell tumors, you have other things like stromal tumors, Leydig cell tumors, Sertoli cell tumors, and these are pretty rare. In terms of presentation of these patients, how do you usually present? Often a person will feel a painless solid or rubbery mass in their testes. They'll have a dull ache and a heavy sensation. 5% of patients can actually have gynecomastia, which is male breast development. They can also have loss of libido. In children, they can have early puberty. Like you can have a 6 or 7-year-old boy going through puberty, and that could be a telltale sign. Some rare paraneoplastic or related but unrelated symptoms you can have is thyroid issues, as well as limbic encephalitis, but it's super rare. I've never actually seen it. In terms of the workup, you check serum markers. You have things. You have tumor markers. You have three main ones. You have alpha-fetoprotein, which you can follow. You have human chorionic gonadotropin, which is HCG, and then you have lactic dehydrogenase, LDH. In seminomas, alpha-fetoprotein is never elevated. If you have a seminoma, but you have an alpha-fetoprotein elevation, you treat it as a non-seminoma in that situation. In terms of non-seminomas, the alpha-fetoprotein is usually elevated, and as is the beta-HCG. That's it for this one. I'm going to make another video hopefully talking about like the staging and treatment of these diseases. All right, thanks. Bye.